All right, and Amy and Teresa, you guys can start and introduce yourselves.
Hi, welcome. We're so glad that you can join us this evening. My name is Amy Henning. I'm the Director of Counseling Services and the Alcohol and Other Drug Program. And I'll have Teresa introduce herself briefly.
Hi, everyone, and welcome. My name's Teresa Smith. I am the Director of Student Health Services, and so glad that you can join us this evening. All right, back to you, Aim. There you go.
Okay. So I'm going to give you an overview of counseling services and hopefully answer any questions you might have about what we offer in our department. So I wanted to start by mentioning or talking a little bit about the transition to college. This is it is a very exciting time, albeit very challenging time right now due to what's going on in our country and our world. However, it's also a time to get really excited about this new transition in your life. But with new transitions, there can be some bumps along the road, and I wanted to make you aware and ensure that counseling services is here to support and assist you as you transition and adjust to this new chapter in your life. Just keep in mind that transitioning to college life takes some time. It's an individual process for each and every student, and sometimes it's met with some ups and downs along the way. Our mission in counseling services is to assist students through any personal challenge that might interfere with your ability to be successful academically. And with that, we provide comprehensive mental health services that are confidential, free of charge, and very well utilized by our students. So a little bit about all that we offer in counseling services. So to begin with, we are located in the basement or the garden level of one of the residence halls named Hines Hall. Our normal business hours are 8 to 5, Monday through Friday, and we do have some limited evening hours until 7 on Thursdays. Currently, we have summer hours, so we are currently open with limited staff. We're open Monday through Thursday, 9 to 3. So if you have any questions, feel free to give us a call. We are open currently and very happy to answer any questions you might have. We, in counseling services, offer free and confidential individual and group counseling for all full-time undergrad and graduate students. We provide emergency triage and crisis intervention. We have psychiatric services by we have a psychiatric nurse practitioner who's with us part-time. We have daily walk-in hours, wellness outreach and programming, an alcohol and other drug program, which includes a lot of outreach and counseling, and we do have a relaxation room. Now, granted, some of this is going to be a bit modified, which I'll get into come, fall when you begin. So we're gonna pivot a little bit in what not so much what we're offering, but how we're offering it. So I'll get to that in just a moment. Okay, so let me just start with some commonly asked questions about our services. So oftentimes, students and families want to know, so what kinds of problems would students come in to discuss with a counselor? And my answer is everything. There is no problem that's too small, too big. We are all trained professionals. What we offer in terms of mental health services is very similar to what a community mental health center might offer. We're all trained and able to manage a full gamut of issues that students might bring to us. The next question, what about confidentiality? If I come to you, if a student comes into counseling services, will we tell anyone? Will we tell parents, faculty, a coach, what's being discussed in counseling? And the simple answer is no. Everything is completely confidential. Once you begin college, you are considered an adult, and we do not share anything, even the fact that you've been to our office, with anyone without your permission. Now, should you want us to consult with a parent, faculty, or a coach, for example, you simply would have to sign a release form and let us know what you would like for us to discuss, and we are able to do so. Next question is, so what is the cost for services? All of our services, for the most part, are free for all full-time undergrad and graduate students. Our psychiatry services do come with a low-cost fee. And if you're a part-time student, we do offer 2 free sessions and then a low-cost fee for subsequent sessions. So what do I do if I'm currently receiving treatment? And my answer to that, my simple answer to that is this. If you're currently in treatment and are curious about the services or how you might transition to our services, I would encourage you to give our office a call so we could discuss before you come to campus what your needs are. If you're continuing with any kind of teletherapy and you're not coming to campus, it might make more sense to stick with that provider. However, we can certainly discuss whatever your treatment needs are and help you make an informed decision. So what if you're on medication? How would you continue medication management? Like I mentioned, we do have a part-time psychiatric nurse practitioner that works with us. And the easiest answer is this. If you were interested in seeing, his name is Dr. Joe Schatz, and if you're interested in working with him, the first thing you would need to do is set up a counseling appointment. So again, we could discuss your needs and then refer you to Joe if we think he could best manage your medication. I will say, best thing to do before coming to campus is be prepared. So talk to your current provider who's prescribing you medication. Make sure you have enough refills before you come to campus, and explore what your needs are going to be before you get here. Because the last thing you want to do is come to campus, maybe make an appointment and then run out of your medication in the interim. So we really encourage you to plan ahead so that you don't run into that problem. The qualifications of our staff. We have 6 full-time staff, including myself. We are all licensed professionals. I'm a licensed psychologist, and we're all licensed social workers, licensed psychologists, licensed professional counselors, and we also have 5 trainees with us. One is full-time, and the other 4 are master's and doctoral level interns that will begin with us the end of August. And they are under supervision from our professional staff. So the question is, can parents consult with professional staff about their student? And absolutely is the answer. So while we definitely keep to our limits of confidentiality, we're always here to answer questions that you might have. If you have a concern about your student, we can always listen and advise, even if we don't share any personal information. Or we could also talk to you as a parent or family member about how to encourage your student to seek services if it's appropriate. Okay, next slide. So, as you know, these are difficult and challenging times with the onset of COVID. And we have been working extremely hard in counseling services since March to transition to providing teletherapy for students. So most of our services, it's beginning in the spring semester, we transitioned to teletherapy. We offer initial triage sessions over the phone, and when appropriate, we will engage in teletherapy either on the phone or through a teletherapy platform. We also had offered and continue to offer workshops that are virtual. We did offer group counseling, and we'll continue to in the fall that were virtual setups. And some of our walk-in hours, we will transition to same-day appointments. But I will say that most of, if not all of our services will be remote. at least in the beginning of the fall semester, to ensure the safety of my staff, and as well as, you know, the students and the staff and faculty. That's not to say that the services will really be any different. They're just going to be delivered in a different kind of way. We do have a relaxation room that we're happy to report that we're going to be making virtual, so you could still benefit from that service. It'll just look a little bit different. And we have plenty of online resources that students can tap into really anytime they're listed on our website. The links are on our website. If you have any questions just about, you know, what you can expect, or, you know, specific questions about your mental health concerns, please don't hesitate to call us or email us. You'll see our email and telephone number up on the screen. All of our services are determined by clinical assessment. So the first step would be that phone call. We would set you up for an initial triage with one of our professional staff. And then we would talk further just about your needs and what makes the most sense, you know, in terms of your care. As mentioned before, we will offer group counseling and virtual workshops, along with some other interactive options that you'll be able to access pretty quickly from our website. And then we also have developed over the last several months many helpful links, apps, articles related to coping with COVID, and just generally how to take care of your mental health. So again, our website, we are working on a first year page. I thought it was going to be ready for today, but it's still a little bit under construction. But, you know, give us a day or two, but make sure you check out our brand new first year student page on the counseling website, and please explore all the different apps and resources that we've developed for you. If you have any questions, please don't hesitate to give us a call, and we'll be happy to answer your questions. Thank you.
Hello, everyone. My turn. Thank you, Amy, for all the information. So sort of in the same format, again, my name's Teresa Smith. I'm a nurse practitioner, and I am the Director of Student Health Services. So I'm going to start my presentation by talking about the services that we provide in student health. So we are a health center that we see all kinds of, we provide a full gamut of services, starting with acute care. So that means anyone who is sick with allergies, flu, cold, COVID. We will be screening. We will be testing for COVID in our office in the fall, along with any types of sprains or strains that would all fall under the acute care window. One of the other services we provide are men and women's reproductive health. We are able to do women's health screenings and women's health exams. We can supply birth control, and then we do a full gamut of STI screening, including HIV. We are a full service lab in our office. So we have a medical assistant who assists us by drawing all of our labs, either anything that myself or one of the other nurse practitioners or one of the physicians in the office prescribe diagnostically, or if you have a standing order per se from your primary care physician or maybe a dermatologist, if you bring that prescription with you, we can perform the lab work right in the lab also. We provide physical exams, be it for a driver's license, maybe a new job, maybe a clinical rotation. We can do that in the office. We also provide immunizations. So as a first-year student and being on campus, there's a certain set of immunizations, including meningitis, that we require for residential students and actually all full-time students to have while they're on campus. And if you are unable to get that completed at your primary care physician's office or at an urgent care, we actually also have them in student health services and can do that within the first couple of weeks of school. We will also assist you with prescription refills. We have an agreement with a pharmacy right down in Glenside called Wesley Pharmacy. And if you have a prescription from a primary care physician that you need transferred to you while at Arcadia, we can facilitate that for you. And Wesley does deliver to our campus twice a day. So they are able to continue to provide us with that service this semester. We also we perform allergy injections. If someone is on standing allergy injections, be it weekly, every other week, monthly, we can help facilitate that. And then we are actually a certified travel health clinic. I know none of us are really doing much traveling right now, but it's, just a little piece of information, a little bit of FYI, that we also do that initial screening process and then help provide the vaccines and the prophylactic medications that you may need. All right, next slide. I did just want to go over a little bit in regards to some campus health and safety practices that we will have in place for the fall. And a lot of this is all of this actually is found in our campus health and safety plan that is on the Arcadia COVID website. But just in brief, as I was getting this presentation together, I was thinking, what do we need to tell our first years who are going to live on campus that they need to bring with them? So especially this year. So the first thing is that, as everyone knows, our governor has issued a mask wearing mandate. So we are going to ask, so we need to wear masks on campus. So we are going to ask that you bring at least 2 masks with you to campus, if not more. Just because, just like anything else, you're going to throw your mask into the wash and then you may lose the other one. And, it may be a good idea to maybe have like a full set of 5 masks, but we are, really strongly suggesting at least 2. The other thing the other process, I guess, that we are going to be asking of our students every day is to be checking your temperature and your symptoms daily. So if you live in one of our residential suites or residential rooms, we're going to ask that before you leave the dorm room in the morning, take your temperature and assess your symptoms. If your temperature is above 100.4, and if you are starting to have any type of symptoms of any cold-like, flu-like issues, then you would want to call Student Health Services to schedule an appointment or at least a triage call, and then, sort of hunker down in your room until we can sort of get everything assessed for you. Other campus health and safety practices, we're going to ask that everybody maintains proper social distancing of 6 feet apart, monitoring your health daily. That also goes to what I was describing with checking your temperature and your symptoms. We're really stressing practicing really good respiratory hygiene. Sneeze in your sleeve, cover your coughs, all those type of things. And then last but not least, using proper hand sanitation. I was joking around with my family the other day. I said, I don't know how many times this summer I have sang happy birthday to myself. So, just good hand washing, bring in lots of hand sanitizer. It will be around campus, but I think it would be a good idea just also to supply, have your own supply in your room also. Next slide. This is just a slide in regards to what our hours are. Again, we are also on the ground floor, the basement, the garden level of Hines Hall, right next to Counseling Services. Our hours are also Monday through Friday, and they're listed here. We start every day at 8:30. We do have 2 evenings of later hours until 7 on Mondays and Thursdays, and then Tuesday, Wednesday, and Friday we finish up around 4:30. We too will be doing sort of, I almost call it our own hybrid model of patients in the office along with doing telehealth also. So for this year, our students are, we are asking our students to call us at the number listed on the slide to schedule an appointment. And at that point in time, they'll be asked, you know, a couple of questions about the urgency of the matter, how quickly they need to get in. And depending on that, we will either schedule for them a telehealth appointment or we will schedule an in-person appointment for them. So we're doing things, you know, we are modifying things a little bit also in our office, but we're still providing all of the same services that we've provided in the past. Next slide. So my little fact sheets here also, who staffs Student Health Services? So right now we are staffed with 2 full-time nurse practitioners, myself and another nurse practitioner. And then we also have our collaborating physician. We have 2 collaborating physicians, and one of them comes to the office once a week. I guess for about 4 or 5 hours a morning. And then we also have a medical assistant who helps us every day, like I mentioned, with our lab work and helps us just room our patients and take their vital signs. We also have 2 office assistants also to help facilitate things in the office. So they will be there, our front line, and then if you call to schedule an appointment, you'll be touching base with them first, and then you know, deciding from there who you'll be following up with. So specifically for first-year students, how do I upload my new health or immunization records? And that is all done through our patient portal. On the home screen of the MyArcadia page, you'll see a little stethoscope, and you can click on that, and you'll be prompted right then and there to upload your student health physical or the immunization records. If you have any questions, any further questions about that, you can check out on my last slide is our web page. But while you're in arcadia.edu, you can go to Student Health Services or SHS, and we have all the steps written right out for you there. What is the patient portal? I guess I should have that as my second question, but the patient portal is actually, like I said, normally where you could schedule appointments, but for now, it's where you will be able to upload your student health records and your immunization records. You will also get notifications through your patient portal. If we do any type of lab work, you'll get the results right through your patient portal. It's a secure site that only you can open up. And is it free to visit Student Health Services? It is. So Student Health Services is also free. There is no copay to walk through the door. The only charges that you may incur are for any of the services that we may provide. So say if we do a rapid strep test, that is $5, and that you can put on your student charge. Or pay cash at the time of the office visit. If you have an ear infection and I need to prescribe you an antibiotic, we can either do it through your insurance and have it delivered to Student Health, or I can hand you the bottle of the antibiotic right from the office, and that may cost you $7. And again, that would just be charged to your Student Health account, to your student charge, or you could pay cash for it. Anytime you have any lab work done, that we use your insurance for. So I'm actually going to scooch down to the last question. Do you have to use insurance, or can you pay through your insurance? And the answer to that, the quick answer to that is no. We don't bill insurance like a normal physician's office would for your visits and what may incur, but except when you have lab work done, then we do use your insurance just for any type of lab work. And as I've mentioned already, how do I make an appointment? You are going to give us a call to schedule that appointment on the number that you'll see towards the end of the presentation. Next slide. So summer support. So again, much like counseling services, this summer looked a little bit different for us, but again, we are still providing support through telehealth. We also are available Monday through Friday, 9 a.m. to 3 p.m. But using our I guess our teleprompter through our phone number, you are able to either leave a message to schedule an appointment with one of the nurse practitioners for any questions you may have in regards to any immunization compliance issues that are coming up, and for any other type of administrative purposes. You can select option 1 and someone will get back to you within 2 business days. Option 2 is if it's immediate assistance, like some type of an emergency, and then you'll be directed to me directly. And then option 3 is if you, again, sort of also emergency situation that you may need public safety for. And again, all medication refills or immunization compliance questions can be directed to option number 1, or an email can be sent to shs@arcadia.edu. Next slide. And then again, here is our phone number. That's our website. And then again, shs@arcadia.edu is another way to contact us also. And I'm going to close my blinds. Excuse me real quick. Woo, so much better. Sorry about that.
You're muted.
Thank you. Oh
There
my
you go.
So anyway, as I was saying, I don't currently have any questions on Mentimeter, but if you have a question, please use what I put in the chat, menti.com, and the code is 271871. Or if you go in the chat feature on Zoom, on the drop-down button where it says everyone, you can just click my name, Lucia, and you can send us a question that way. So other than that, unless you have a question, I think we are done. So thank you so much for coming. I'm also going to drop into the chat the link to our live sessions page so you can get credit for coming today. This can serve in place for your Nightlife portal, Student Health Services and Counseling Services page. So just as a reminder, the portal, the Nightlife portal stuff is due July 31st. So if you want to be entered into that $500 gift card to the bookstore, please make sure that you are completing your armor by the 31st. And if you have not done so already, make sure that you have taken your placement exams, you've signed up for an advising day, and you're reviewing the schedule that has been placed on your account for right now. And obviously, as you've been told a million times, that schedule can change all the way up until when classes start. Let me just check one other thing. I'm going to check the Mentimeter again. Make sure we have no questions. We have a question about where to submit physical and immunization records.
Yep, that would be me. So that can be uploaded through your patient portal. So if you go to your myarcadia.edu homepage, Across the top banner, you'll see a bunch of little icons. You're going to click on the stethoscope. And it'll say patient portal. It's a little stethoscope, patient portal. You click on that, and then you'll be prompted on how to upload your immunization records and physical.
Awesome, thank you. And then I'm not seeing any other questions at the moment. So thank you everyone for coming. I think Teresa and Amy might be okay with staying just for a couple more minutes, just in case anyone does have a question, but I did just drop in the chat the link to get your credit for your Nightlife Armor. So thank you all so much for coming.